Task Force for 2022. My name is Randy Belhumer, and I'm from the Department of Health and help to support the food systems work on behalf of the department. And we might have other members of the Rido family with us today who also help to support this work. From the division which I'm housed, Community Health and Equity, we might have Lauren Conkey with us today, and also Erin Bertoli, and from the Health Equity Institute, Deb Golding. And let me start by sending a warm greeting from Rido's interim director, Dr. Jim McDonald. We spoke on Friday, and he's offered his support as we continue to work on this critically important topic. I'm sure you're all aware of the data that came out a while back from the Food Bank's most recent status report on hunger. Hunger across Rhode Island communities decreased from 25% in 2020 to 18% in 21, but it's still double from its pre-pandemic levels of 9%. So take a moment to reflect back on all of your hard work over the past 2 years of this pandemic. You as individuals, as organizations, and as part of the Hunger Elimination Task Force have been resourceful and creative in supporting Rhode Island's most food insecure citizens. And the leadership of the task force really looks forward to 2022. And we know that the way to continue this creative and resourceful work is by all of us working together. And today I'm also pleased to welcome a new member of our leadership team, Caitlin Mandel, who has accepted our first ever role of Food Access and Equity Manager. So thanks to Rido's some CDC COVID funding for allowing this to happen, and also for the Food Policy Council for partnering with Rido to support Caitlin in this nascent role. Caitlin comes to us from Hope in Maine, where she served as their food systems equity manager since 2021. And I mentioned the importance of our continued creativity and resourcefulness. During the pandemic, Caitlin created, I'm sure many of you are aware, the Nourish Our Neighbors program, which is a supplemental food assistance effort that employs local food producers to create healthful meals for community members facing food insecurity, I believe on the East Bay. I would argue that this work is not only programmatic, but also systems change work to lift up our local food systems as well as working towards community resilience. So we're excited to have Caitlin on board as we begin to more deeply actualize what we hear from our state agency partners, as well as from many of you. And that is to facilitate collaboration and information sharing across multiple food system stakeholders. So we have a great meeting in store for you today. And with that, I'll pass it back to Nessa to get us started. Thank you.
Thank you so much, Randy. I just want to start out just by acknowledging Rido and this partnership, our Director of Food Strategy, Julie Stelmasic, and for all of the work that you have done to support the Hunger Elimination Task Force over many years, and also want to acknowledge the Rhode Island Foundation and other funders who help us do what we do. I am going to first go over the agenda for the day, and then just a reminder of our goal here at the Hunger Elimination Task Force. So after a welcome and introductions, I'm going to review the 2022 Hunger Elimination Task Force plan. This is the plan that you all helped to develop, especially during our Q4 meeting of last year. And then we're going to have a breakout session where we break into the work groups that you identified as high priorities in that meeting. We're going to have a panel which will highlight the municipal role in hunger elimination. And then a second breakout session where you'll be able to have conversations about how you work with your city and town government, or how you might want to work with your city or town government. And we'll finish up with some announcements about upcoming events and opportunities. So The goal of the Hunger Elimination Task Force is to reduce hunger and increase access to healthy, culturally appropriate food for all Rhode Island residents. This task force was initiated by Governor Raimondo, former Governor Raimondo, in 2017, and it was convened in order to develop recommendations and action steps to reduce food insecurity levels. The group developed a strong list of recommendations that were presented to our state's Interagency Food and Nutrition Policy Advisory Council in 2018, and then communicated to a wider audience in 2018 and 2019. And we're very fortunate now, all of us, to be able to build on this foundation. We started building in 2021, and last year we welcomed over 150 different people representing different organizations, community-based organizations, health equity zones, nonprofits, emergency food providers, state agency staff, healthcare professionals, many others to those meetings. I just want to take a moment to put the council's role in context. We work in close partnership with RIDO and the State Director of Food Strategy to provide staffing and capacity to coordinate the task force's quarterly meetings and any working groups that are identified and prioritized by the task force members. We conduct outreach to broaden attendance and to communicate the activities to a wider audience, and we'll do our best to secure resources to do program and pilot evaluations and to assist in developing recommendations for stakeholders and for policymakers. We did these things together in 2021, and we're really looking forward to working with all of you in 2022 to further the collective work of hunger elimination in our state this year. As Randy noted, we're very excited to be welcoming a full-time food access and equity program manager on board at the end of this month, who's really going to be working to move this to the next level. And I know that she's looking forward to meeting all of you. It's also really important, I think, for us to point out that we are not the task force. You are the task force. Your decision to show up today, to connect with the others who are here, and to contribute to the conversation that allows all of us to make an impact together that is greater than the sum of its parts. So just want to thank you for that. So now I'm going to go over the proposed Hunger Elimination Task Force objectives and 2022 activities. As noted, during the Q4 meeting, there was a breakout session where members were invited to share their hopes and their needs for what the task force could accomplish to support them in their goals and objectives in the coming year. And task force members emphasized a number of themes. The membership still needs to grow and broaden, while maintaining the trust that has been built or was built over the course of 2021, especially reaching out to communities and individuals that aren't well served by conventional food access networks, municipal governments, healthcare entities, and food sector businesses. It was a clear theme that food equity should be a central lens for the work being done by the task force. Some members wanted to engage more fully in state policy work and understand how activity at the State House impacts hunger in their communities. People definitely wanted regular presentations by those who run state and federally funded food access programs like the SNAP program and from the food bank, and also that an annual State of the State Food Insecurity and Access report was useful, which was provided in Q4 of last year. So we used your input during that Q4 meeting to plan out the objectives and activities for 2022, including generating a list of potential working groups that targeted areas that you indicated were high priorities for collective action, and we're going to go over those in just a moment. First, I want to go over a summary of the priority activities you voiced at the year-end meeting. They fit into these four main objectives. So first, to broaden the network of actively engaged stakeholders and to lift up effective community-based solutions to specific food justice and food access problems. Really ensuring the voice of those with lived experience is present and represented as much as possible at the convenings, and to continue to expand membership, including nonprofits and community-based organizations, as well as municipal leaders and business leaders. there were some specific areas of targeted outreach to municipal entities and BIPOC-led organizations, as well as the healthcare industry, that were identified as underrepresented in 2021 that we want to reach out to. We are also, in terms of forming the working groups, focused on these specified high priority topics that you'll see a little bit more about later. We want to deepen the collaborative environment for medium and longer term problem solving across agencies, non-governmental organizations, community-based organizations, and individuals with lived experience. This means inviting presenters, including regional presenters and state and community level presenters, to highlight innovative hunger elimination programs and policies, and to focus on those that are bootstrapping community-led innovations and serving high-need populations, as well as inviting presentations from state-run programs. There was also a real interest in meeting in person at least once over the course of the year, possibly having as easy access as possible a field trip that would engage attendees in small group conversations. We want to provide as many forums and mechanisms for participants to engage in facilitated problem solving, group problem solving activities that contribute effectively toward medium and longer term improvements in the state's hunger relief efforts. Third, we want to reduce food insecurity by generating and providing information that helps member organizations connect food insecure people with emergency and supplemental food delivery services. This is what our 2021 working group was about. We developed a resource that is going to be shared more broadly in 2022 through platforms such as Unite RI, and also just directly to those who are helping people access food in their communities. We're also going to continue to hold and harvest these breakout sessions during each of the Hunger Elimination Task Force meetings. And then finally, to solve systemic emergency and supplemental food delivery and distribution problems by identifying and advocating for and educating decision makers about solutions, about policy, investment, and regulatory solutions that can increase the effectiveness and resilience of the emergency and supplemental system in responding to shocks. So advocating for high priority investments that address hunger elimination priorities is part of the work, as well as working with key decision makers responsible for state planning processes to connect their goals with the goals of the Hunger Elimination Task Force. We also definitely want to be working with our Director of Food Strategy, who is embarking on an update plan for Relish Rhodey, our state's food strategy. And we look forward to working with her on that as well. And as the coordinators of the task force, we look forward to working with our state agency partners to report out to the state at the Interagency Food and Nutrition Policy Advisory Council and other state venues as requested. So the thing I want to go over before I come off of the slides and we move into the working groups is going over those working groups. This list was sent out to everybody in advance, so maybe you had a chance to look at it beforehand. If not, there's a link to a document, a one-page document in the agenda that we sent out. So the task force establishes working groups when a group of interested members want to study and report on a particular question and make recommendations based on its findings. As I noted, there was one working group about emergency and supplemental food delivery in 2021. About 6 people joined it. The council staff supported meeting coordination and eventually hired an intern to assist with the research project. So if you attended that Q4 meeting, you might remember that intern, Juliana Esposito, sharing what she found in her research about gaps in local and state level emergency and supplemental food delivery. So that's just one example. And this year, you mentioned in Q4 meeting a number of different potential working group areas where members may want to come together and do that kind of work collaboratively. Improving emergency and supplemental food delivery for homebound people continued to be a theme. So taking that resource, figuring out how to distribute it, and talking about how it may result in policy recommendations. Also, getting more local food into the emergency feeding system. Improving SNAP and WIC utilization and operations was a third area. Connecting specifically with municipal governments was a fourth area. And then 2 specific populations were of interest: serving aging populations, which we would certainly want to do in partnership with Age Friendly Rhode Island, and addressing food access and insecurity among students. So these are the 6 areas. I'm just going to leave them up there for another minute, because when I take us off of the slides, you will be asked to choose one. So just take another minute to look at those. And if you hadn't had a chance earlier, click on the link in the agenda so you can think about which one you would want to join. Now I can see everybody. Wonderful. You all look great. What we're going to do now is move into breakout sessions that are organized by these topics. And you are going to be invited to join the one of your choice. You won't be put in randomly. You'll need to select you should each get an option to select one when the breakout rooms are opened. There are no expectations of you other than to engage in a conversation with the other people who are there, who are interested in the same topic. You are not volunteering to be part of a breakout, of a working group. You're simply participating in a conversation that's discussing what a work group could do. A facilitator will be present with a few guiding questions and to take notes for everybody. And every facilitator is going to put a link in to something called Jamboard. It's a link that you can click on if you feel like it, to where the facilitator is going to be taking notes. So with that, I will hand it over to the council's communications manager, Allison Montagnon, to open up the breakout rooms. And Allison, is there anything else that you want to offer or recommend for folks before you open those up?
No, I would just say, give it a minute, because sometimes, because there's so many people on this meeting right now, it takes a minute to generate. So if you don't see a flag right away, just give us a second, and then I'll be waiting. I am in my own group here, but I'll be waiting to log into my breakout room to make sure everybody gets in the right space.
Sorry, Nessa and Alice, are we supposed to be seeing something where we can click on?
Yeah, there should be a pop-up. Give me a second. I can also reset it.
Okay, I didn't get it, but maybe others did.
I saw a pop-up that said, please select a room, but not with a room choice.
And Allie, I haven't been assigned to a room. I have a pop-up. I see some people are joining rooms.
Allison, I went into a room, my room, no one was there. And then I was prompted to leave the room, that it was going to close in 59 seconds. So I came back.
All right. We'll take a mulligan on this one. Give me 1 second, okay?
Okay. Karen is asking to resend the invite.
She mean the invite to, I thought I let her into the meeting early on. Does anyone see? I don't see her name on my screen.
I don't know.
Karen is here. I see Karen, but I think she's just waiting for the invitation. So you're resetting the pop-up, correct?
Yeah.
And then maybe you can just talk people through how to join a room.
I'm going to paste the rooms in just a second in the chat, and then you can kind of, there'll be the list of the group names that you were looking for, and you'll see it there.
Allison, are you still generating the pop-up?
Yeah, I just wanted to reset it.
Okay.
And Nessa, you'll have to join your room after because you're a co-host. So you and I are on like a separate.
Okay, that's fine. Always the technology that gets you.
It is. Thanks, everyone.
Yeah, I was
Okay.
leading a workshop at Hope and Maine the other day, and I had all these polls prepped, and then I tried to open it, and nothing happened.
Does everybody see the pop-up that says join a room?
I do.
How do
Okay.
we know which room to join?
I'm going to post it right now. Just give me 1 second. My screen's freezing a little bit here. I'm going to turn off my camera.
Just for the people that might not see it, it's on the bottom where all the icons are, like all the little apps.
Yeah,
So
oh,
say
that's right.
breakout room, and that's where you have to click, because mine's just popped up.
Yeah, that's right. You have to scroll down to the bottom of everybody's name, and then there's a join button for every single breakout room. And yeah, now people are getting it.
How do we know which room is ours?
Allison put a link, something in the chat that identifies which number room is associated with which topic.
Oh,
I don't actually see it in the chat. It's possible that maybe it just went to you.
So Ava, which room do you want to join? I can manually add you to it.
Remember the titles, but the one about more local food into the emergency food system. Please and thank you.
That was 2.
Nessa, this is Karen. I'm sorry too, but I don't have it in the chat, what the room labels, which is the student?
That's number 6.
6, thank you.
Is Snap and Wick, Nessa?
Allie, was Snap and Wick number? Let me just open it up. Hold on. I'm going to read them out to you guys because I see a lot of people are making progress, but if I read it out, that'll be easier. So I believe number 1 is improving emergency and supplemental food delivery for homebound people. So that's the delivery one. Number 2 is the local food into the emergency feeding system. Number 3 is improving SNAP and WIC. Number 4 is connecting with municipal governments. Number 5 is serving the aging population. And number 6 is food access and food insecurity among students. Would anyone like me to restate those? Okay, Allison?
I am here in voice. Yes, my screen is totally freezing.
Why don't you help the last people? There are a few people who haven't joined yet. Why don't you help them get joined? Because I need to join my room now.
Please, yes, go right ahead. And Sam, if you don't mind popping into room 6, that would be really helpful because that's where I'm going to be once I get these guys set up. So I see that Erica has not joined yet. Miss Erica,
Sorry,
where can I send you?
I'm not seeing the numbers at all. Where are they supposed to be?
In the chat. I don't know if you can see the chat.
Well, so I see the key. So I'd like to join number 2, but where is the actual breakout room that you click? I never got a pop-up.
There should be a pop-up, but don't worry. I'm just going to assign you that room. It'll give you 2 seconds and you'll be there.
Thank you. There we go.
Last but not least, Jair and Jasandra. How are you, friends?
I was
Where
deciding.
Oh man, thanks so much for bearing with me. Where can I send you?
You can send me to 2.
You got it. Thank you.
I'm gonna join 4, so I'm good, Allison. Thank you.
All right, cool. Miss Megan, how are you?
Good. So I'm actually participating in another conference today.
Yes.
So I just had a break in that conference and I wanted to log on here, and maybe see if I could just get quickly connected to something or other.
Yeah, I'm going to send you to Caitlin's breakout session because it's perfect for you. It's about food access for older individuals. So I'm going to send you right to room 5.
Thank you.
Hello, room 5. Thanks for bearing with me. My screen is totally frozen, so I'm zooming on one window, but I'm unable to access our Jamboard. So I don't know if Sam, you're able to do that for us. Did I lose Sam? We lost Sam. That's okay. I will take the old-fashioned type of notes, but I would love to know if you guys wouldn't mind kind of like sharing your initial thoughts. I know that there were a lot of questions on the pre-reading and the agenda itself, but by all means, whoever wants to start, you go ahead and kick it off. And I'll just be jotting down your thoughts over here.
I can go. So my biggest concern with food access among students is it has to do with the conflict between Title I and the Community Eligibility Program. So Title I is determined, Title I funding for schools, which is like the largest federal funding for schools, is determined by individual applications for the National School Lunch Program. And the Community Eligibility Program was designed to no longer require the individual applications and instead to increase the funding for school lunch programs on a per district basis. However, since they no longer require the individual applications, schools risk losing a significant amount of their Title I funding when they transition to a community eligibility program. So even though the CEP gives more funding for the the National School Lunch Program in schools, they risk losing a significant portion of their federal funding because they're no longer tracking the economic data that they use the census to determine the CEP, and they use the National School Lunch Program to determine Title I funding. There is a bill, I know, in Rhode Island to just universalize free school lunch in Rhode Island schools, but I'm not sure how they plan on reconciling the funding with like the federal funding.
That's excellent. Oliver, do you mind telling us your background? Like where are you representing here today?
Yeah, I work for Means Database, which is a 501c3 nonprofit that helps move excess food from from donors to recipients.
Okay.
And I research policy. Yeah.
That's awesome. So thanks. That's great. Does anybody want to kind of feed off of what Oliver is saying here? No pun intended. So this first question is just what the group really wants to accomplish this year. So it doesn't have to be like heavy stuff. It could just be even just a small tick on the long game that we're trying to tap off. It's more just an opportunity to think about where everyone's at. So if Oliver's coming at it from like a food rescue and policy perspective, I'm sure there's other people in this room that are from a totally different angle.
I'll jump in. My name is Joanna Corcoran. I'm the Executive Director of We Share Hope. And I mean, for us, we are a food rescue organization. We're contacted by smaller groups, other church groups and community groups who ask for food donations so that they can create bags of food the kids bring home with them on weekends and on school vacation when they're not receiving food assistance at the school when the school is in session. So it's an interest of ours just because we want to make sure that we are supporting those groups in the best possible way. And we're also looking for collaborators to see if that's something that we want to sort of grow and help more kids, at times when they're not receiving school sponsored food. So that's sort of my goal here in this particular breakout session. And then just to sort of piggyback on what you were saying, Oliver, would love some more information around ways that we can advocate on behalf of what's happening. I think that would be really great. We have a great following on social media, and I think that any opportunity where we can add our voice and ask our supporters to add their voices to advocate for that funding, I think would be awesome. So if you could share a little bit about that, that's something we might be able to do right away today.
I imagine you're right. That's great. Yeah, we do have some, like the Policy Council has some ARPA recommendations we're rolling out, and we're trying to advocate for a lot of stuff that is definitely in this wheelhouse. So that's good. But I guess that's why we're all here, right? Okay, so does anyone else have like thoughts to contribute on, what you would like to see as far as like the working group related to this specific priority?
Right. So this is Alice Howard. Just want to add a few quick thoughts to what previous speakers said, both of them. So I'm from Sunrise Forever Incorporated. We're a 501c3 nonprofit organization for those of you who do not know. So our central focus is on creating a conducive learning environment for students and families, and by providing necessary tools, materials for them to be able to stay in school. So that is tied into full assets. So my interest in this group is to be very supportive in making sure that students have access to food, right? So I was just wondering, I did not follow it year round, but I'm not sure the lunch program, is it done year round or is it seasonal?
I can
I'm
answer
not
that.
sure, actually.
I can answer that. I'm Jessica Petrolia. I'm the coordinator for child nutrition programs at the Department of Education. So the National School Lunch Program, which is what operates during the school year, is available, as it sounds, only during the regular school year. But there are additional supplemental federally funded child nutrition programs that operate year to fill in the gaps. So there's the Child and Adult Care Food Program at-risk after-school meals component, which also operates during the school year, but allows schools to provide snack and supper in addition to breakfast and lunch that they would receive at schools. And then there's also the summer food service program, which can only operate in qualifying communities where there's demonstrated need within the community. But if a site meets those qualifications, those meals can be provided during the summer, and you can do breakfast and lunch under that program, or any combination of no more than 2 meals.
Right, okay.
So that's interesting. I now I have a lot of questions about that, but I'll let you guys continue. So that's a great question, Alice. Continue if you want.
No, that's good for now.
Okay.
Yeah. So I'm just all for helping them year round with whether they are in school, because students struggle, people come from different backgrounds and different things that hinder people's progress and things. So we have to be supportive, because it all boils down to knowing the people and getting to just support them, meeting their needs where they are. So it involves a lot of things. So I just wanted to share with that. In school, it's all is there, but after school, there are also issues that students face,
So Allison, this is Karen Wetherill with Rhode Island Healthy Schools Coalition. Just want to follow up on that. Jessica's absolutely right, and her department does oversee all of the child nutrition programs, which are federal dollars that are available in our state, but there need to be sponsors of all of those programs. So that's where I think we could use really stronger connections in communities where it's available, but there needs to be a summer program, or it's available, but a school district really could provide a supper program, a snack program, learning, just as you said, Alice, where are those students? Where could that program be to meet the needs of a group of students there? So it's really making those connections between what's the availability. The programs are there, the dollars are there, but we have to make sure that we have a sponsor and we advocate for that where students are, where the need is.
I wonder too, on that note, is there a resource that would tell us that? Does that exist, or are we maybe building that resource? Like, how do we know where the most in need communities are?
Well, it depends on, RIDE maintains a list of the communities that free and reduced percentages by communities, and that's how the USDA defines need in most cases, although there are some alternate methods depending on the program that you're talking about. One of the concerns right now is that because of the pandemic and the flexibilities that are in place, there is no free and reduced data. Back to the most recent data we have is October 2019. And so like USDA, for instance, for the upcoming summer has still not addressed what they're going to do for eligibility criteria, but we know that we don't have good data to go on if we go revert to a more quote unquote normal circumstance. So, but we within my department maintain a list of sponsors, sites, and also potentially eligible communities based on the schools within the communities. I would just jump on to what Karin said too. And also, I think I only caught a portion, Oliver, I apologize for what you said, but I think, it sounds like we're probably right in line in terms of wanting to see advocacy for continued implementation of universal free meals in whatever form that is, whether it's CEP and disentangling the funding formula from the title funding that goes to schools or in addressing it through other means. But I also think that there's a need to kind of combat the misinformation in the community, particularly that comes out of communities that are considered to be of less need, where people are very skeptical of the universal free program and the cost that it's incurring to the government. There was, a story that came out in Barrington just recently that wasn't as inflammatory as it could have been, but it was a little bit misleading in terms of the way that the programs operate and, who's benefiting most from these types of programs, when the real answer is that the students are benefiting most from these programs. And that's, maybe it's a political, different ideology about who is funding what, but it needs to be addressed and we need to combat that misinformation.
And I'll just say, Jessica, to follow up on that, is that I think, and due to the pandemic, but it has been illuminated because of the pandemic, there are a lot of struggling families that either might be right on the edge and even reduced meals. So if they complete an application, and that in and of itself is a barrier, we know that in communities, and it's a burden on the school district to be able to do a good job. You have to do outreach. You have to be able to talk to families when they're available in a language, in a way that they can understand, to build trust about filling out a federal form. And even if they do, and they are able for reduced cost, and they have a number of children, that right there can sometimes be an expense that they can't afford. So there's many families that either if they choose not to, or they're just not aware of it because the overwhelming nature of their lives, other things going on in the family, that they haven't completed an application. There is no school in our state that is going to deny food to students, none. They will give them a reimbursable meal, and the district will cover that expense. And so you might remember years ago in Warwick, it turned into a big national news story about the debt that the district, unfunded debt from students who would get food from school, reimbursable meals, but didn't have money in account to pay for it and didn't have an application that was approved that they were eligible for a free or reduced meal. So right now there are districts too, and this often might be in previously in suburban districts, that had these families kind of right on the edge, and these free meals over the past 2 years, I think, have been very helpful. And we really don't know, Jessica, to your point, what the data is, because I think that has changed, right, in family situations. And so I think we're really looking at, in terms of providing healthy food access for students, this is a really critical juncture because of this complicated USDA program. And as Oliver started off with, that link to the education funding through the title funds.
Excellent. This is all very good stuff. Okay, so if there are does anybody have any more comments to follow that up? Because I feel like that's a lot of great stuff that this group can be like accomplishing on in a single year.
I've got one more.
Yeah, go for it. That's what we're here for.
I would say that my last one, and we've already started some conversations on this, but it's kind of in the same vein of stronger collaboration across not only state agencies, but community-based organizations to streamline the benefits process for families, particularly families in schools, and whether that's related to, if you're receiving SNAP benefits, then you should automatically qualify for school lunch, and just kind of like making sure that other agencies are aware of the benefits that qualifying for one particular thing within your program could also qualify you, and being able to make the correct referrals. The Healthy Schools Coalition and RIDE have already started talking about, and we've worked with DHS too, some SNAP outreach that would actually be specific to benefiting schools if we go back to meal benefit applications, but there's definitely room for more collaboration and more voices to be involved in that conversation.
That's a great point. Thank you for saying that. Ooh, I see some hands up.
Sarah, I just don't want to be repetitive, but I just want to throw in this, right? So like Jessica Redley and Karen, I want to agree with the two of you. We have to simplify the application because I run a nonprofit, and just since last year, my organization through collaborative work with the commercial fisheries with our foundation, we serve like 300 families every week. We give them food. So we hear all these stories about some people want to apply, but they are afraid, and I think the application is kind of so complicated. They feel that they will be denied. So if we simplify things and make them just feel comfortable, right, then we'll have them come through to put in applications. Some people want to do it, but they are like, if I put this application, I'm going to be denied, and stuff like that. So we have to just, and collaboration, coordination, like Jessica says, very important with all of them, because we hear all of these stories. And so I think it was Jessica for somebody. You'd be surprised. You think that Barrington and other areas, they are good, but there are also needs in those areas. So we have to keep that in mind. Anytime I have something in my bag, anytime I do the off. Yeah, thank you.
That's excellent. Okay. Looks like we have some hands up. So I see, why don't we go with Bridget first here?
Hey, Allison. Hi, everyone. Bridget Sweet, Johnson & Wales University. I was actually kind of looking at, obviously, the K through 12 was really important, but also access to students that may be in the college landscape that may not be eligible for benefits because they're full-time enrolled, et cetera, and may not be on a meal plan. So kind of looking at that landscape as well, not just K through 12, although I just wanted to make sure I made that point. And then I guess just a quick question for Jessica. Are you looking at maybe like a roadmap or a decision tree to make available to those community organizations that say, if this, then this, so that there's a listing of eligible other community families may be able to take part in?
Yeah, something similar to that. We've seen resources out of other, like Washington, D.C. has a resource that pertains to the different assistance programs that are available. So not only that, though, I think it's important that we identify where hunger screenings are happening throughout the state, and then how can we use whatever resource we create to best refer people to the resources that exist. So kind of like attacking it from multiple angles.
Excellent. Thank you.
That's a good question. Lori, I see your hand up. Go right ahead.
Hi, everyone. Lori Moyes, Director of the Healthy Communities Office. I just wanted to tack on to Jessica's point around outreach to families. And one thing I see happening is the misinformation. And I just wanted to highlight that and exclamation point and underline that a lot of it is misinformation, fear. I know Alice mentioned the paperwork is too long. I don't know what leverage we have in order to either shorten the SNAP benefit package or educate our parents, because most of them believe that they're either not eligible or will be deemed as a public charge. There's stigma alongside SNAP benefits. And I know on the city side of things, are working on that education piece and getting the word out there as much as we can with all benefits through our SOAR program, but it does not go through to the schools as yet. But it would be great to have that as an item of discussion for the year and or for whichever work group is associated with that. But I think one of the biggest gaps, there's many, is that familial piece of having families understand what SNAP is and how it can benefit. Anecdotally, my mom mentioned during the pandemic, had she known when we were younger that she was eligible for SNAP, she would have signed up, right? But instead she worked 3 jobs in order to make ends meet. So I think that's where we should start. And I'll get off my soapbox now.
Thank you. That was actually really thoughtful. I love it. I mean, I think these are recurring themes, which honestly, I think is a good thing, right? It gives us a nice concentrated set of priorities for this group, if this were to be the working group that we decide to develop. So I think that's super great. So on that note, the next question that we're being asked to ask is, within this group here, what are the assets that you think you could bring to getting this work done? If we did want to simplify the forms, if we did want to update information or dispel any kind of misinformation, who in this space has something to contribute to that effort? And or how would you do it? And again, this is just like open conversation. No one's like pinning you to these things that you're saying right now.
I mean, on the policy side of things, the Healthy Communities Office, we have the ability to share issues of discussion with legal partners, counsel, whoever we need to in order to push. It doesn't always end up successful, but we do have the ability to go into the policy side of things and try our best to push the best items, bills forward. And of course, community education, we can definitely lean in on that in Providence, at least.
Yeah, that's a good one. That's all very important stuff. That was Lori that said that, right? I was not looking up.
Yep, that was Lori.
Okay, thanks.
And then the Healthy Schools Coalition, we have strong partnerships with many community organizations and relationships with district wellness committees in the districts throughout the state, which includes administration and parent groups. And as well, you know, I think for advocacy with the professional associations like the Superintendent's Association or School Committee Association, because again, I do think that there's a lot of misinformation and that there's not the realization that this is a really important time, what we move on to from now to ensure that students have access to healthy food. So if we get the right people, and whether we're doing surveys or trying to identify what are some of these from the community, from families, what are the real issues that are barriers that we can help identify what those are and work with our partners in the schools and in the community.
That's an excellent one. Okay, I got all that, I think. I mean, I paraphrased, but that's great. When we report back, if I miss something, please don't be shy about speaking up, guys, because there's a lot to absorb here. Okay, so what else? What other assets do we have here within this room?
Oh, sorry.
No, it's okay. Go ahead, Jessica.
I, on RIDE's behalf, am likely the keeper of most of the data and all of the knowledge about the programs and the regulations, and also potentially the source of funding. We already fund the work through Rhode Island Healthy Schools Coalition to do like our wellness policy outreach. We have specific summer program outreach that we fund through our administrative dollars related to the federally funded child nutrition program. So we probably have limited staff, but a lot to offer generally out of my office.
Well put.
I'm Francesca Gallo. I have a few different hats, but I think the one salient here is work as program associate with the Henry P. Kendall Foundation. We're based out of Boston, but do regional food systems funding. And one of our focus areas is farm to school, both for K through 12 and then higher ed. We're kind of working on our strategy and especially incorporating justice and equity. So this might change, but currently our focus is generally on supporting local and regional food procurement into schools, which I think right now the relevance of that is largely, I think, the disrupted supply chains, leaving a lot of issues for actual procurement. And so we try to help support ways that you can still get food into schools in other ways. So, you know, we're a foundation, we make grants, but also kind of have a lot of partners in the space and generally want to help in lots of ways that we can.
It's quite a room, I have to say. This is nice. Oh, I'm just seeing the comment in the chat. And Yema, are you with us in this room still? No, I think he left. But he was not hearing anything, so nevertheless, that is okay. Okay, so I think we're ready to go back. I'm gonna close the breakout rooms here and then report back. And like I said, if I forget something, let me know and interrupt. And then of course we'll have some follow-up materials going out. So if you think of something afterward, we can still amend the notes, okay? But
Thanks,
thank you all
Allison.
very much.
Thank you.
Probably going to take a minute for everybody to get back in here.
Welcome back, everybody. I hope everyone had a good breakout session. I'm not sure if everybody is already here or if folks are still streaming in. We let that breakout session go a little bit long because the conversations just seemed really rich. And we're going to shift the agenda a little bit because of that. We were going to do breakout session report outs before we did our panel, where we're going to be inviting our municipal staff to speak. But we're not going to have time for those report outs, which is fine because I know that all of the facilitators were busy scribbling notes, and we are going to put together all of that information, pull out some key themes. One thing I would ask you is if you didn't get a chance to actually volunteer, if you wanted to be part of a work group and you want to be contacted to continue that conversation with a small group, you can just let your facilitator know or let me know. I'm sure we'll also be following up with ways to sign up as we send out the follow-up messages related to this, this task force meeting. So with that, we're going to move on to our panel, which is about the role of local governments in hunger elimination. And I'm really grateful that a couple of municipalities have volunteered to be part of this panel and called in some key community partners, and that the president of the board of the Rhode Island Food Policy Council, Diane Lynch, has offered to be the facilitator for the panel. So Diane, I cannot see you right now, but I trust you're out there somewhere, and I would love to pass the beacon over.
Thank you. I'm a quarter-inch high head on your screen. Well, thank you, Nessa. So this panel today is really interesting. We have two municipalities, Providence and Warren. And from each of those municipalities, we have someone from their town government or their city government. And we also have one or more of the partners that they've been working with on hunger elimination. And I know that not every municipality, we have 39 of them in Rhode Island, has programs like this. Not all of them have the capacity to do this kind of work. They're all very different. But it is interesting, the ones that are working on it, the kind of work that they're doing is really good. And we thought it would be really helpful for more of you to learn about it. It might spur some thinking or some new collaborations in your own work. So we have from Warren, we've got 3 folks. We have Anne Marie Roy, and Anne Marie has worked with the town. She's in the town government for over 30 years. She's done a ton of different work. Right now, she is the program director for their social services department. And she is going to tell us a little bit about what her job is and how she works with partners, how she works with the town government. And maybe she can also touch on what she thinks some of the challenges and successes are. And she has invited 2 of the partners that she works with closely. One of them is Kristen Reed. She's the director of the Warren Health Equity Zone. She's based in the East Bay Community Action Program. She's done a ton of work in nonprofit management, education, et cetera. And then also Maria Ursini, who is the executive director of the Benjamin Church Senior Center in Bristol, who also has a long history doing food access work and community building work. So we'll start with them. And then after they've had a chance to talk to all of you, we'll talk about Providence and we'll introduce the folks from Providence. If you have any questions or comments, just put them in the chat. And we'll either get to them after everyone has talked about what they want to talk about, or we will follow up after the meeting. So I can't see Anne Marie, but I know you're out there. So if you could unmute and take a few minutes and introduce yourself and talk about your work, that would be great.
Yep.
Good afternoon. My name is Anne Marie Roy. I am the program director for the town of Warren, and I do social services and prevention for the town of Warren. And like you heard, I've been here over 30 years. I started when I was a very young person. So Warren's population around 11,000 people, and we have a pretty high need of food, and during the pandemic, things have grown. We have partners that we work with. We work with a group called Tap-In, which is in Barrington, and in 2021, they saw about 174 households, 433 people, and which they distribute food to. So that's quite a bit just from one small organization in that time. We also work with East Bay Community Action, and during that time, their food pantry serviced, let's see what they serviced from their food pantry. Sorry.
Anne Marie, I have a question for you.
Yeah.
When you say you work with these partners, do you mean that you provide them with funding, or you provide them with other resources, or how do you actually work with them?
Not funding. God, not funding. Well, whatever they have for resources, they help the community. So that we work together to help the people in our community.
So give us an example of what that means for you. On a
So
day-to-day
if I have a client that is in need of food and I don't have the food for them, I can send them to Tap-In. I can send them to East Bay Community Action. I can send them to one of the churches. If they're in need of rent, if they're in need of heating assistance, and I don't have the funds, and I don't have the things that they need in my budget. These other programs have it, and they'll take care of this person. So that's how we work together to make sure that the families and the people in the town of Warren get the assistance that they need.
That's great.
Yeah.
And do you think that most people know about you guys? Like how did the population there, how did the residents there become familiar with the services that you offer?
Well, we have brochures. We're under the town website. Word of mouth. Word of mouth is probably the biggest thing. Somebody finds out about us, they all know about us, especially through the holidays. We do food baskets for Thanksgiving and Christmas, and Christmas presents and stuff like that. One person finds out that that travels very fast. So yeah.
Yeah.
And then we have repeat customers or clients or whatever.
Yeah.
They'll come back. Yeah.
Yeah.
Yeah. Family members. We've seen generations walk through the door actually sometimes. So.
Yeah. Has the job changed much in the last 30 years?
Yes. In the beginning, when I started, we used to do a program called we used to do part of the state program, the welfare program. It was called welfare program at that time, but it's not anymore. So the welfare director used to do the state program. We used to see clients, general public assistance, GPA. So single people that were on assistance would come here, and we would sign them up for assistance, and they would get paid through the town, and then the state would reimburse the town, and we would pay all their medical bills and then their biweekly checks.
Mhm.
And then that program dwindled away, and mostly that was for people that were had some kind of substance use, and they were in a program. They had a document that they were going through the programming.
Mhm.
And that did dwindle away after about 10 and 15 years.
Yeah.
Yeah.
Maybe we can hear from your two partners.
Yeah. So
yeah.
Maria Orsini is the director of Benjamin Church Manor in Bristol, the senior center director. So, and she also works on prevention with me.
Mhm.
So I'm gonna, we can flip this over to Maria, and then we have Kristen Reed, who's our new HES director. She's been here for about 3 months, I think, but she knows the town really well too, and she's very knowledgeable too. But we'll start off with Maria.
Great, thank you. Maria, if you want to unmute.
Hi.
Hi.
My name is Maria Orsini, and I've been dealing with the public for quite a few years. I work with Anne-Marie here, but I also work at the senior center, and I can give you a little bit of both. For an example, like Anne-Marie talked about, you know, agencies that we work with, we do work with East Bay Recovery Center. They actually have a mobile food pantry that comes down once a month, and that goes over really well. That's held in the parking lot, and they get quite a few people that come through. We're also fortunate enough that they will leave us some food. I would say approximately 6 months ago, we started with a tiny house, a food pantry right outside our office. So that goes over really well. We're constantly filling that, especially, you know, during the weekends and the cold months that we've had. We're also lucky enough that we've had community members that help us and fill that up. So that's really important. And so, and, you know, like Ann said, she works with quite a few other local churches and individuals that support what we do here. I can talk about what we do, what I do in Bristol. I'm thankful for everybody. Hope in Maine has been unbelievable with us since this pandemic. And do you want to just lower your thing? Because it echoes.
Oh, it doesn't.
Put it off. It's in your mute. Can you mute you?
I am muted. Oh no.
Sorry, I can hear an echo. So during this pandemic, you know, we were fortunate enough that Hope in Maine helped us. I'm going to talk a little bit about the senior population because, again, we just wanted to keep them home and safe. And it was really important for me to be able to have food available without these individuals actually going to the grocery store or going to food pantries. So what we've done a lot with, and we still continue doing, is delivering actually groceries and meals to them on a daily basis. I'm a little bit disappointed with our state that we really weren't ready. Well, none of us was ready for this pandemic, but there wasn't a good collaboration with I hate to say this, I'm going to go say it out loud, with, you know, some of the municipalities. And again, I'm going with a senior center part of it because we do see a lot and we do service a lot. People don't realize how important that is and how we can connect with that population. Again, we need to make sure that they have their nutrition and that they have the proper food, and thankful for everything that everyone has done. I have to say that we've had quite a few agencies that have reached out to us and offered us supplies that we make sure that we deliver. We're talking about some months that we deliver to over 350 individuals. And you know, and it constantly goes, especially during, you know, the harvest time. And we do have also, I'm not sure if most of you have heard, a food voucher that seniors can get. They have to sign up for it, and it's distributed to all the communities. Let me tell you, we start getting phone calls in May that people want to know, where's my food voucher? Because they do like to go to those farm stands. They like to get fresh produce. That's really important to them. I just wish that we could offer them a little bit more than what they get for $15. So that's just a little bit on, what we do. We feed between what Hope and Main has done for us and our seniors. We're talking about close to 20,000 meals in 1 year, and that doesn't even count, our Meals on Wheels program. So it's really,
Maria,
it's important.
it sounds like most of what you're providing is delivered. Is that correct? Or are some people coming by and picking up? I'm just curious.
We do have some people that come by and pick up, but what we try to do, especially at the beginning, and then obviously they just kind of get accustomed to it, is deliver. We do have volunteers. At the very beginning, we were fortunate enough that we worked with our local YMCA, and they had staffing at the time. They helped us out, I would say, for probably a good 4 to 5 months on delivering food. And again, as a nonprofit, we wouldn't be able to run without our volunteers.
Yeah.
And that's what keeps us going.
Yeah, and delivery, I just came from the breakout room. Delivery is a pain point for many people, not just for seniors either. So it's great that you've been able to make progress. And it sounds like you're doing an amazing job too. So thank you.
I appreciate that.
Yeah, no. In the interest of time, I'd like to move over to Kristen and give her a few minutes as well, but that sounds great. Thank you.
Sure. Thank you. Hi, everybody. I'm Kristen Reed from the new Warren Health Equity Zone. We actually received our funding in July as part of a third cohort of health equity zones. And so I've been on board since September now, and wanted to talk just briefly about what it looks like to collaborate with municipalities in your first year as you're getting launched as part of a health equity zone. So in a health equity zone's first year, you're really building a collaborative. You're getting to know the community, and then also determining what your objectives are. So we want to be resident led and resident informed, and so a lot of what I've been doing is speaking with key informants. The town has helped to identify who I should be talking to as part of the food systems and the emergency food systems here in Warren. And then also through the East Bay Community Action Program as my backbone agency, really provide a lot of social service sort of network. So another great resource for me to engage in the community. We are a small town, and which meant that we have formal and informal systems that are being used for accessing food. There's good communication, good coverage. So for example, the elementary school phys ed teacher knows who needs food delivered and can't get to a pantry. We know where the food pantries, so St. Mary's of the Bay food pantry is open and available to everybody, and is open twice a week and provides sort of people are able to shop, make their own choices in a meal order. Again, highly reliant on their volunteers, but are really seeing a lot of folks. And Hope in Maine, in addition, is a Warren. We brag a lot about Hope in Maine, our food incubator, and they have been, really key. And Caitlin, who our loss, our gain sort of situation, really with that. Nourish Our Neighbor was able to distribute healthy food, and as we talked about, really have that be part of the systems shifting. I think another thing to talk about, another one of the questions that came to me was, what are my how am I connecting with the municipalities? So currently our Parks and Rec is working on a community garden. I'm able to make some connections, see where intersections happen between recovery community and the garden, for example, and pull those pieces together. Hope in Maine wanted to expand and be able to bring food to families and again to the recovery center, so was able to help and negotiate some of those connections. And then another piece of the health equity zone work has been, we've been asked to provide masks and self-test kits. And so a vehicle for doing that has been to partner with St. Mary of the Bay and make sure that those food pantry patrons can receive have access to self-test kits and to KN95 masks. And that's been sort of a silver lining opportunity. Also through Anne Marie, of course, making sure that her folks that are needing them have access. And then just briefly to talk about what I hope to see happen that have come out of this first year. I hope the municipality would really like to have our families be signing up for free lunch, to know that they can access it, and then for us to be able to get additional dollars because everybody who's eligible is taking advantage of that. So through community health workers, help with that benefits navigation. A shout out to Joyce Levin, who's on the call, but I know that our students in our summer program, some of them can't get to the park. And if we could do a walking school bus sort of idea where we make sure kids are at the park and they're getting food in the summer that they might not be able to access, that's another line of work. And then finally, the WIC dollars, you're not able to use them locally other than at one CVS in Warren. And that's not on a bus route that's highly, that's easy to get to. And so figuring out how we can't get our convenience stores or our market, have them understand the importance of their role in this community is something that we hope to advocate for. So,
wow.
Yes. A lot of information.
So thank you so much. So the big problem here is that I don't have enough time to actually continue this conversation because there's so much to talk about. But I do want to say that it's really inspiring to see the collaboration. So you are each working in different organizations, but you're just, your exchange of information and help and networking is just phenomenal. So,
and Diane, if I may, I think one of the priority groups and lenses around which we'll bring a collaboration will be around food insecurity, will be around food in some way. So we'll have a working group that comes from this collaboration and sort of hopefully knits it together in an even stronger way. Yeah.
So for those of you that are living in municipalities that do not have this, like an Anne Marie, and that they don't have that, whatever. I mean, this is a little bit of an illustration of how that can actually help pull things together, and what kind of impact it can have. But thank you so much. We may have time for questions afterwards, but I'm going to move on to Providence now, and then we might come back. So thank you guys. So Providence, obviously very, very different, very different, very large, very different municipal structure, but we have with us today, Rachel Newman-Green. Providence has something called the Healthy Communities Office, and Rachel is the Deputy Director. Hi.
Hi there.
Nice to meet you. After she tells us a little bit about what she does, we've invited a community member who has worked with your office, Gisandra Barros, who can also join the call, and then she can talk a little bit about what it's like from her perspective as a community member to be working with you.
Sure. Hello, everybody. As Diane said, I'm Rachel Newman-Green. I'm Deputy Director of the City of Providence Healthy Communities Office. We are definitely working at a different scale than Warren and a lot of the other communities. Providence is 180,000 residents, so definitely has a different structure and everything a lot of other communities in the state. But Our office within City Hall, basically we work under the mayor's office, and we are the public health and promotion office. And so we are not very directed towards, we don't really engage much in direct service. We're very much about setting policies so that the city operates in the best ways to promote public health. So the ways that we do that is really by making sure that the policies by which the city operates, and that is sort of in as many things as we can get our fingers into, are promoting good health, and in particular, and that has been, you know, working with the Parks Department, that has been working sort of with all kinds of different departments. In this particular area around food, food systems started becoming a concern of our office sort of many years ago, but has had increasing engagement and concern with that issue. And our office, you know, the mission of our office is to create an environment in the city where all residents have equitable access to opportunities for good health. So we're talking about equity in Providence, really looking at the economic and demographic and cultural profile of our community, and making sure that when we're talking about equity, we're really talking about the folks who are most impacted by food insecurity or other, you know, food systems gaps, which is very high number of very high immigrant population, a relatively high refugee population, and you know, largely a community of color for the most part here in Providence. So you can't really talk about food security without talking about making sure that you are addressing the cultural needs of those communities. Providing food that is not what people eat or doesn't, you know, is not the kind of thing that will promote a healthy family environment, that sort of thing, is not helping the situation. So we really engage in a lot of different ways. Our the city's urban agriculture initiatives sort of rest under our office, and so we work to support urban farms, urban gardens, which are largely a immigrant and refugee sort of population that uses those. We work very hard to support the farmers markets in our city, and especially the farmers markets that provide opportunities to food insecure folks. So we work to make sure that people who are low income or of other populations that you don't think of as your typical farmers market clients are discovering those and are using them well. And one of the factors in that also is that we have a lot of the farmers markets here in Providence. Actually, the farmers themselves are residents of the city and are reflective of the cultural mix of the community of the city. So the more that we're able to support those businesses selling at the farmers market, the more we're supporting those communities too. So other ways that a number of years ago, we wanted to look at city food purchasing and how that was supporting a good food system. And when we broke it down, really just about the only food that the city sort of engages in purchasing at all is through the school system. So our school system right now is, well, interestingly, this year I think it's about 22,000 kids. In 2020, it was 24,000, so that's concerning. Where did 2,000 kids go? But looking at the meals that are provided in the schools is very important. Our schools are, last time I checked, 86% of the students throughout the district were eligible for free and reduced lunch. So what that means is we actually have community eligibility here. Free breakfast and lunch is provided to every child in Providence Public Schools. So that's an enormous amount of food being put out there. So really working to make sure that that food also is as high quality as possible. When you look at, you know, 20-some thousand kids getting 2 meals a day, that is enormous, you know, health and nutritional impact in our city. So we've worked with the school district to form priorities and really shape the last food service contract to make sure that it was moving towards the highest quality that we can get. We've also worked with the Parks Department, which operates our summer and after school meals programs throughout the city to help them with program development and outreach and other things to improve quality of those. So Jazz spoke in our breakout group a little bit about work that we did to actually work with a youth farming program to help use their produce that they were growing in the USDA subsidized or reimbursed summer meal. So that was very exciting. So we kind of work throughout all the systems. And then of course, when COVID occurred, all of a sudden we were on emergency food response. And that was a very, like I said, our office has not typically been a direct service office. We work very much through partnerships all throughout the city. So a lot of the work we did was in supporting those partners, other agencies that were doing emergency food response, but our staff was literally filling their cars with frozen meals and bringing them out to parking lots and giving them to people also. So
you gotta do what you gotta do.
you gotta do what you gotta do, right?
Yeah.
But I think one of the things that we all know, this isn't news to anybody, is that we suddenly realized that we were really unprepared for the kind of emergency that we were faced with. So one of the things that I hope to do in the next year, I'm hoping if everything goes through the right channels of democracy and bureaucracy, that we'll be able to use some of our ARPA funds to actually develop a emergency food response plan for the city. Which, I'm thinking in the face of future emergencies, but realistically, we're still in an emergency right now. And I think a lot of the responses are still seat of our pants. So figuring out how we can really do that in a way, my feeling is if you don't have a good plan, there's no way to be equitable about what you're doing. You're always going to get the people who are the lowest hanging fruit. People who already know what the resources are going to be first in line. So my priority is to set up a plan so that we can actually make sure that equity is integrated into how the city is responding to the current emergency and future hypothetical emergencies that will no doubt.
Well, that's a great goal. And I think that you are not alone. I mean, at the state level, and certainly a lot of what we talk about at the council is no one was really prepared. And so we don't need to make that mistake again. Right. That's actually something we can do something about. Yeah. So let's do something about it.
Let's do something about it.
Yeah. Very interesting, very different role, obviously, because you're doing so much more coordination between between organizations. If you don't mind, I'm going to bring Gisandra on. I don't know where there you are. Hi, Gisandra. Just as a note for you guys out there, Gisandra is also on the Food Policy Council, and this year is the co-chair of the council. But here, Gisandra is speaking as her role, Southside Community Land Trust, and just as a citizen of Providence who works with the city, the Community Healthy Communities Office. So maybe you could just tell us a little bit about what that's been like for you.
Yeah, so I do a lot of what my role is at the Land Trust is really to coordinate and connect with various groups and coalitions, and the city of Providence being one. I actually got involved specifically with working with Healthy Communities Office and the city of Providence through the African American Ambassadors Group, and so that was started in the summer of 2020 in response to all of what was happening. With so much, but specifically in regards to all of the uprisings that was happening. And the group itself formed different committees, one of them being food disparities. And so I joined as a part of what the group was doing before I joined, which was to survey specifically the BIPOC community in Providence to get an understanding about kind of what the needs are and to understand the ways that people currently interacted with food systems and where people were getting their food and how they were getting their food. And so that survey was put out, and I had just responded as a resident of Providence. And from there, I joined the group. And at the time, we were trying to put together a way to kind of disseminate the information. And I think what was really important about that particular survey, and I believe Danny Ritchie joined the task force at some point to present about that survey. And what we're really trying to do is kind of not be prescriptive about the way that we think about food disparities or food insecurity, and really get to more of a sense of what do the people who have the need, kind of how they define their need and the ways that they would like to engage in addressing the problem. So really it was framed as how do you define healthy eating? And that's not the way it was actually written out, but it was more or less that, which is when you think about eating well, is what we use, you know, what does that mean to you? And from there, and through other questions in the survey, kind of looking at how can we address the folks who responded to the survey, which a number of folks were folks who were using the emergency food system, particularly the food pantry at the Federal Hill House. And so we wanted to work with the city through that initiative and the African American Ambassadors Group to start a pilot program where we could do two things, kind of address some of the gaps that there are with the emergency food system, in particular, folks who don't qualify, because there's an income gap where people don't qualify for any food assistance, but they are still food insecure and still need assistance. And so how we could address that. And so that's what we did. We started the program this past summer in 2021, and we're looking to continue that and really addressing, you know, that food need, but then also connecting with local farmers and local growers and how we can kind of support on that end of bringing more of local food into emergency food assistance.
That's great. Thank you so much. So the work that you're doing is really based on the way people are defining it themselves, what they want and what they need, which is really a great starting point. Thank you. So unfortunately, we're almost at 3:30 and we need to be respectful of everybody's time. So thank you, Gisandra. Thank you, Rachel. I'm going to hand this back to Nessa so that she can close out the meeting.
So much, Diane, and to all of the panelists. And I know it's 3:30 right now. I'm going to ask you, if possible, to answer one question in the chat before you go, which is, what would you like to see your city or town government do to support your food access and equity objectives in 2022? If you can just put one sentence in the chat, I think all of you probably have an idea of that. We'd love to capture that and report back to the group about themes. What would you like to see your city or town government do to support your organization's food access and equity objectives this year? And to keep us on time, the only other thing that I want to note, one announcement, which is our remaining meeting dates, which I'm going to paste in the chat as well, but I'll also state the next one's on Tuesday, May 3rd, July 26th, and October 18th. And those are all going to be from 2 o'clock to 3:30. So again, we'd love any feedback you want to provide in the chat, what you'd like to see your city or town government do. And then to close out, after I paste these in the chat myself, to close out, just want to thank you all for joining the Q1 meeting. We look forward to seeing you again soon. Thank you so much. And thank you for all the work that you do. We'll just keep the chat open for folks who want to drop their thoughts in there before we close out.
I'll keep the recording going so it can make sure we capture all of the stuff in the chat.
Thanks so much, Allison. Those of you who have participated before know that we take our note-taking and recording seriously. So we will definitely be getting notes and recordings out to everybody. It takes us a little while because we really like to synthesize what you said in the breakout rooms and in the chats. And we like to kind of break that into themes to share back with everybody. Ali, I'm going to capture the chat now. And I think, yeah, you can probably end the recording. I think probably we've captured everything that we're going to capture.